Good afternoon, everyone. Sarah Barker with Connect Our Elders, and today is another Empowering Aging podcast. I'm very grateful to have Sherry Herrick with us today as our guest. She is the Director of Operations of A Better Solution in Cincinnati, Ohio. And I have no doubts that you are going to enjoy hearing about her background and the tons of experience that she's bringing to her new role in launching A Better Solution in Cincinnati. Sherry, thank you so much for being with me today.
Thank you for having me.
You're very welcome. So without further ado, would you mind sharing with the audience your background, the whole breadth of background, and what has led you to the position that you're now in?
Oh, okay. Well, I started in skilled healthcare at the age of 23. I'm not going to tell you how old I am now, but it was quite a long time ago. I worked in that industry for a very long time. And I was quite happy in it. About 10 years ago, I realized that there was a big gap in what happens when the patient goes home, or even when they're admitted with the elderly, and what their pain points were, and what the physicians and the other nurses were experiencing, as well as social workers. That led me to go into home health. Mm-hmm. That opened my eyes even more. Home health can only do so much. Mm-hmm. And there needs to be another layer to that care. You're going to get, as most of you know, you're going to get a nurse visit, if you're lucky, twice a week. Aides to come in and help with ADLs are far and few between because insurances don't pay for that. That leaves a lot to be desired. You have clients that are coming home from the hospital, especially the elderly. They come home with a list of new medications, if they were able to get them. And then they come home and they have a medicine cabinet full of their old medications. And they're like, what do we do with this? Well, let's just take it all. And they do. And that leads to another problem. They're back in the ER, or they don't have transportation to get them on their follow-up appointments. Mm-hmm. Home health comes out. And by the time home health can get out there, even though it's supposed to be 24 hours, we all know that that's in a perfect world. And these days that may not happen. No one is there to help them. They have no one to help them bathe, no meals. They come home to rotten food in the refrigerator. They come disoriented. Mm-hmm. They need laundry done. They need bed changed, just about every ADL you can think of. So the more I worked in intake in home health, I thought there has to be a better solution. Well, along came a man who owned a home care agency, and he contacted me. He was looking for a general manager. Well, of course, at first I was like, no, this is private pay. I am not dealing with caregivers and private pay. I'm just not doing it. So I had about 3 or 4 meetings with him, and I found we were on the same page and we had the same desires to make sure that that population of patient/client, they didn't fall between the cracks. And I also learned that we could be a very valuable layer to home care and discharge planners in the hospital, as well as social workers. So I began working with him and learning a lot about the industry. It wasn't as easy as I thought it was going to be. I said, this is a piece of cake. No, there's a lot of different mechanics to being in home care. I find it to be extremely rewarding. There are times that I find what I call the sandwich generation now. You have, especially in this day and age, you have clients whose children are still taking care of children and now have to take care of an aging parent, or not even aging. Let's say their husband develops ALS at a very young age. Mm-hmm. Instead of being the spouse or the wife or the spouse or the son or the daughter, they become the caregiver. And that's extremely hard. And that's a lot on the family dynamics. And that's where I like to come in and say, we can help you with these issues. Now, granted, most of it is private pay and some people can't afford it. But there are ways to get around that. There are different outlets that you could go to, whether it's, whether you have long-term care, whether it's, which doesn't pay for it all, but it pays for a very good chunk of it. or let's say, your retirement or a reverse mortgage is even possible. And that will pay for it. Or let's say there's lots of siblings and they don't all work full time, but I can come on this day and maybe you can pick up here, or we can get a chunk of 6 hours here and we'll come after work. There are different ways to realize how that can be paid for. And it's amazing. I can say that being in the skilled part was rewarding, but being in non-skilled, even though I hate that word because people who do this for a living, they're very skilled. I like to say it's non-medical.
There's different skill sets, right? Just because,
Exactly.
We talk about skilled care versus non-skilled care, it does not mean that the non-skilled, non-medical home care is not a skill set that is very needed, which is
right. It is very needed, and it's not easy to do. And it takes a very, very certain type of individual. I mean, staying with someone, which a lot of us know, with Alzheimer's and dementia is not easy. A lot of times you are walking the floors the whole shift and nothing but redirecting.
And Sherry, I like what you said about, because while it is private pay, you are taking the approach where you're looking at the entire situation to help that family problem solve if the desire is to remain home. How can we uncover funds, which, you mentioned the reverse mortgage, but just yesterday, there's a situation where a life settlement is an appropriate solution. And so I want to make sure that I thank our sponsor for these Empowering Aging podcasts, which is Retirement Genius. And they do facilitate those life settlements when it's the right solution for the family, right?
And I just learned about that yesterday also.
I love it.
I love it. I was like, I never even thought of that. But, and I hear a lot, you hear a lot about the reverse mortgage market. And at first I was kind of skeptical. But if you have someone with a $300,000 house, and most children are going to, the greatest generation, they have it in their head, they have to leave something for their family. That's just how it is. It doesn't always happen that way. And that's where the kids come in and say, Mom and Dad, or whoever, you have given me the tools I need to be successful. I don't need your money. I love it, but I need this to help take care of you.
And where do you find, Sherry, because I have had that similar experience when I've been working directly with families, is that the aging parents have this idea that they have to leave it and that that's what the children want. And the children, aren't even knowing that that's what their parents are thinking. And there's just this lack of communication. So how do you come in and facilitate that conversation?
When I first do an assessment, before I even do it, I ask, and it's usually the oldest daughter that calls, or if there's no daughters, the son, whoever is there. Sometimes it's a niece or nephew. I just say, who's going to be involved in this assessment? And I like it to be another person besides the client. And even if they have a spouse, are there children involved? Can we please have them involved? And as many as can attend. And I'm happy if they can't all be there, I'm happy to talk to them on the phone at another time and say, this is what we're doing. Because when you get siblings in, they're all going to have a different idea of how to take care of mom, especially the ones that aren't really doing the hands-on care.
And geographically separated oftentimes.
Yes, exactly. And so I like to talk to as many as the family members that are involved as I can. I like them to make a well-informed, educated decision. And they don't have to make it right that minute, especially if there's finances involved. Go talk amongst yourselves. See what you can do. What chunk of these times that you need us can you fill yourself?
So proper care planning.
Saves money. And this is what we can do. And what don't you want to do? We don't want to change mom or dad. We don't want to give a shower. Okay, well then you obviously want us there then. So no siblings, no children then. So I said, identify your greatest area of needs.
I love that question.
Work around it. What can you offer? Maybe they have older grandchildren. Susie gets out of school at 3 from college. She can come over after she's had something to eat and sit with grandma in the evenings, put her to bed. There you go.
So you're really taking the approach of educating,
Mm-hmm.
problem solving, and let's talk about the coaching aspect, because I find a lot of times, I'm not sure, I call it coaching because a lot
It
of
is
times when I'm
coaching.
dealing with the adult children,
Mhm.
it's coaching them on how to broach these conversations, how to communicate with their aging loved one, how to make the recommendations, how to include their loved one in the decision-making process. So what are your thoughts on that, and how do you see yourself coaching the families?
First, I always talk to the client. I talk directly to the client with the family around,
Mhm.
and I do include the family in, but I don't just talk to a daughter or a son and act like the client isn't there.
Mhm.
That's, to me, it's disrespectful, and it's taking away that they can still make their own decisions in most cases. When
Well,
they
the
can, I
dignity.
understand. Yeah, and with dignity. And so I direct those questions to them. They always refer to their children. And then I'll say, how do you feel about this? You
Mhm.
know, well, I'm not really into, I don't think I need someone to help me. And I'm like, okay. But do you go down these basement steps to do your laundry? Well, I have for the last 40 years. I'm sure you have, but you're really weak now, aren't you? And your legs aren't as strong as they used to be. Well, yeah. Sometimes I just go down on my rear end. Well, you're going to fall and you can't carry your laundry up. You can still fold your laundry. How about if we have someone go down and get it for you and bring it back up?
Right. So Sherry, you and I also talked about this, and it's this whole, when we speak reality, it's not with the intention of doing scare tactics,
Mhm.
right? It is
No,
not about that
it
at all.
doesn't work.
It is about, we're telling the truth and the reality,
Mhm.
because as senior care professionals, we both believe, we talked about this, that we have a responsibility to tell them the truth.
Yes. And it is. I would never go in and say, well, if you don't do this, your family's going to put you in a SNF or assisted living or CCRC. That's not what we do.
Hmm.
They may do that anyway, depending on what they feel, but I do educate them on what a CCRC is. And I mean, if you need a sniff, then we're really not for you anyway, unless you need a sitter.
Can you
Because you kind
explain? Let's do a little
of,
educating, a deeper level educating right now for the audience, right? Because families will watch
yeah.
the recording of this if they're not watching live. But let's talk about the differences between home health and home care, and then also explain what is a SNF and what's a CCRC. So let's start with what's the difference between home health and home care.
Home health is usually medical. It involves a nurse most of the time. It involves PT, physical therapy, occupational therapy, and sometimes speech therapy. A physical therapist can open the case without a nurse, but they have to open the case before any of the other disciplines can come in. What's provided with home health is usually those items. They can come in and set a Medi-Set for you. They're going to come in and see how you are responding to treatment after discharge. Sometimes they will also send in wound care. If you leave the hospital with a wound or the rehab with wounds, they can come out and have the wound nurse come.
Mhm.
But it's usually once or twice a week. The family still has to be very involved because they're
Mhm.
not going to come in every day and change a bandage. They're going to
Mhm.
teach you. These are what we call teachable skills. They're not
Mhm.
going to come in and have you, even if you're on, like, let's say a blood thinner, like Lovenox or Coumadin, they're not coming out to give you that shot. That's a
Mhm.
teachable skill to a family member or a friend, as well as, let's say you're discharged now and you're on insulin. You either have to give it to yourself or the nurse will do some education. A
Mhm.
lot of times they'll come out for one visit and do that type of education.
Mhm.
They're not going to go through a refrigerator. They're coming out strictly medical. If the doctor has ordered PT, OT, speech, wound care, they will come out also and open accordingly. Usually it's for a time of 4 to 6 weeks. Usually it's 4 weeks
And how's
max.
it paid for?
That is paid by insurance.
Mhm.
Insurance does cover that. And that's basically what they cover. They don't cover any more, they don't cover any less. Everything has to have a physician's order, and the order has to be signed. Um, we have Oasis. They have all this paperwork that has to be completed before they can open your case. and get paid.
Mm-hmm.
And the doctor has to sign off on it. So if they can't get the doctor, run him down to sign off on these OASIS and these paper, they're not going to come because they're not going to get paid.
Mm-hmm. And what is home care? Because I know oftentimes the families are not understanding the differences, but also the healthcare system,
Right.
and I know, right, they're dealing with a lot of patients, but there's this massive confusion around what is the difference between home health and home care, and how are each paid for. So how does home care compare to home health? How do they work together?
Right. Home care is basically non-medical. You usually have a CNA, which is a certified nurse assistant, or an STNA, which is a state-tested nurse's assistant. It varies state to state as to what you can use. Some states are like, we've had people on staff that their mother was an aide, they're an aide, they love doing that work, they've done it their whole life. And so what is involved is they can come in and help you with ADLs, which are assisted activities of daily living, bathing, making sure that you have proper food, running errands for you, taking you to and from the doctor, helping you medication reminders. They cannot, unless they are a nurse, fill a Mediset.
Mm-hmm.
Now, a family member can, no problem. Some agencies do have nurses on staff, but they charge per hour for that, which is about $125 for someone to come in and fill the Mediset. So if the doctor has it all labeled, it's much better for the family to do it. And then staff for home health or home care will do med reminders, put it in a little pill cup and watch them take their meds.
Mm-hmm.
We do companionship. That's huge. Sometimes our caregivers are the only people that family member will see all day. The only thing,
So share about the psychosocial well-being of the people that you have served and that you will serve.
Most certainly, almost more important than anything else. Imagine not talking to anyone all day long. You just sit there, stare at the TV. And we don't want to just engage in conversation. We want to find out, what are your joys? What brings you joy? What brings you purpose in life? Everyone needs a purpose when they get up in the morning. And you can learn something new every day, including at 95.
Mm-hmm.
The mind if you don't use your mind, it's going to stop. Mm-hmm. So whether it's, let's say they like to do puzzles, they like to play Scrabble, they love this new computer stuff that came out and they want to see it. We want to engage, we want to compare, we want to find our caregiver that's also has similar interest. Or maybe they have glaucoma and they can't read like they did. Let's read them a book. Let's learn about their history. What did they do? A lot of these people have fascinating history, and you can learn so much about them that you would never really realize, because you're going in and you see them as, oh, wow, you've got Parkinson's. Oh, yeah, well, that's a shame. Oh, you can't use your left hand. Oh, wait a minute. You were a vice president of this huge top 10 company in America. What did you do for them? It's amazing what you can find out, and they love talking about it.
So how do you ensure, because there are a lot of home care companies across the United States, right? Mm-hmm. So, you're launching a Better Solution in Cincinnati right now. So how are you going to ensure that understanding all of those fine details that really do raise the level of service to your clients, how are you going to integrate that into your assessment process, but then the delivery through the care professionals?
With care professionals, it's education, 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 education. And your assessment is only as good as what you've collected. So the care manager or whoever does that assessment has to do their due diligence. You have to find out. You're not going to go in there and find everything out in a half hour. And I tell them, I'm going to be there for at least an hour and a half because I need to know everything. I'm not being nosy, but I need to know everything to make this work. I'm not going to send someone in there that's going to sit down and watch Days of Our Lives with your mother. That's not why we're there. You're not paying them to sit there and watch TV with your mom. Mm-hmm. And this is what we want to know, what her needs are. I need to know what her daily routine is. What did she like to do? that she's unable to do now? And can we assist her in doing that safely? She may not be able to do it all. She may not be able to go out and garden and plant a flower, but she may be able to help.
Right. And then how do you keep track of, because, decline is, one of the biggest purposes of home care is ensuring the safety, right? But the highest quality of life as possible, as long as possible. So, as you bring a client on and then time progresses, how are you making sure that the care plan is what it needs to be at any given point?
Supervisory visits, depending on the number of hours they have. We also instill in our caregivers, you're a vital part of this organization. You're my eyes and ears. If something is unusual or something's changed in their condition, Mrs. Jones isn't right today, that means that care manager or myself, we have to get out there and check Mrs. Jones. And we have to respond to the family and let them know what's going on. Otherwise, depending on the number of hours, I always like to say we do a 1 week visit, then a 30-day visit, 60-day visit, 90-day visit. And then in between there, I may see my client every 2 weeks just because I want to see what's going on. How are you? And it's fun to talk to them.
It's a relationship.
It is a relationship, and you earn their trust, and they know that you're there to make sure what's going on. And I tell them, Susie isn't going to get in trouble, but what's going on? Are you guys doing okay? Is there a caregiver you like more than the other? I've often tell my clients in their assessment, if you are not connecting with our caregiver, that's okay. Because I tell the caregivers, it's okay if they say, nice girl, but we just don't seem to click together. And don't be offended, as well as the caregiver telling us that. Right. We like Mrs. Jones. I really like her, but I'm not really sure she's for me.
Right. Because you want it to be the best match possible.
It has to be the best.
Both sides to feel safe in communicating honestly about how they're feeling.
You have to set both sides up for success. And sending someone in there, let's say your client has dementia or they don't have or they have ALS, sending someone in there that doesn't have skills for a Hoyer or a sit-to-stand or doesn't want to do a dementia client, that's a recipe for disaster.
It's a bad match.
Yeah, very bad. And the family's going to go, what did you do to our mother?
Let's talk a bit about the financial aspect of this. We've already shared that for the most part, right? Home care and private pay, long-term care insurance, and then, there's alternative funding solutions and whatnot. But let's talk about how, because I know sometimes home care providers, they're still a little comfortable about really going deep into what the financial picture is. But I believe that we are doing a disservice to the client and the family if we don't go deep on that, because, right, if we don't know fully what the picture is and they need X amount of care, but it might not be sustainable, and then we could possibly put them in a bad position. So what is your advice to the families about understanding why somebody like you or I will be asking these financial questions?
I tell them basically because exactly what you said. We are number of dollars an hour times number of dollars or hours a week. I also let them know if you need holidays or whatever, and some do, that's time and a half, because we pay our employees time and a half to really sit down. And I need to know, is this sustainable? Because let's say you do it for 3 months and then you find out we can't, this is really a big chunk of change. They didn't think about it. You really need to sit down, discuss it as a family, discuss it with your parents or whoever the client's going to be, to make sure you have this, because disruption in service or switching them to a different type of care is very disruptive in the elderly.
I was going to bring that up too, right? So if we can from the beginning understand the budget that we're working within, but the plan is not just when we're starting, okay, there's a schedule. The planning, proper care planning is, okay, here's where we're starting, here's where it might grow to, but this might be a trigger that, okay, we need to bring in a different solution now, but they know up front. So it doesn't come as a traumatic disruptive
Mhm.
surprise.
Right. And there are different ways to do that. Like I had said, the first thing I say is, well, we have family. What can the family do? Even if they don't have children, nieces, nephews, sisters, brothers that are younger, what can you do? We've had neighbors help out, or they're like, hey, we can get mom into a half-day daycare. And then they'll bring her home, and then you could do a 4 to 6 hour shift with her, and that saves money instead of having a 12-hour shift.
How do you feel that your approach, right? It's very consultative, not just slinging caregiving hours, which is what I teach people not to do, right? You know, how do you feel your process is going to really differentiate you in a better solution in Cincinnati?
I think because we care. We care. I'm not there. I mean, yes, the bottom line is the dollar. Let's face it. We're not in business if we don't.
Well, you won't be helping anybody if you don't save
Right,
business.
exactly.
That's a fact.
I'm there because I generally care. I want the best care possible for my clients. I want them to age in place if that's what their wish is, but I also want them to have purpose and quality of life while being safe in their own home. And that's go ahead. No,
absolutely. So let's say, you bring a client on and, to clarify for the audience, I'm going to make it simple, right? What Sherry's saying is very consultative approach with the family, making sure that it's going to be customized, but also really keeping tabs on what's going on. So that way you can continue to make professional recommendations that fit the situation. So what is your whole philosophy on if you notice maybe somebody is improving? Are you going to recommend that we decrease?
Yeah,
or
I
you're
always
be confident to recommend an increase in hour because that's what's right?
Sometimes the other people in the consult are like, no, we need these many hours. Okay. All right. I'll go in and go, after a week, we really don't need to be here that much. Let's back off a little bit. Give her a little bit more freedom, because they feel smothered and they get really angry that somebody is sitting there, what they say, babysitting me all day, and she doesn't have anything to do. Okay. Or they'll go with the limited hours, and I'll go in and go, we need more hours, and this is why. And I make sure that I have an educated assessment in front of me so that I can explain piece by piece, not just I'm adding hours or decreasing hours, but why I feel I'm doing that and how I'm going to follow up on that to see how that works. We can always change it. I tell them, you are not bound by 8 hours a day, 4 hours a day. You're not. We can change this to fit what the needs are and where the pain points are.
What are your thoughts on, I feel like home care is the solution. Yes, it is for the person in need of the care assistance, but it is a solution for the whole family. So what is it that we really sell? I think peace of mind.
We sell peace of mind. We sell family values. We sell peace of mind. Safety. Mostly, I think we sell peace of mind.
Absolutely.
Peace of mind and trust. We gain trust. And how do we gain the trust? The easiest way to gain trust is to be on time for your shift. That's what I tell my caregivers. I mean, because the greatest generation, if you're 2 minutes late, you're late.
Right.
You're late.
Exactly. And I know that you're going to be communicating that to your caregivers, but also explaining why it's important. That's the thing. Like, so many people, you can tell them what needs to happen, but it's so much more powerful if you tell them why and what are the implications if they don't.
Right. Exactly. And I do that in orientation. I actually will have them read over our policies, procedures, stuff like that, and say, what do you think that means? What does that mean? Have you ever had a situation where that happened? What were the consequences? All actions come with consequences.
Absolutely.
Do you want your loved one sitting there because you're 15 minutes late? You might say, oh, I was only 15 minutes late. Well, yeah, you were. But that client, no matter the age, they could have been in a Depends. They were sitting in that Depends all night. Do you want to sit in your Depends all night?
Right. Explaining to them the gravity of it.
Yeah, and it is. You're not trying to be over dramatic, but it's the truth.
So what are some good indications? Okay, so I don't think that it's ever too early for families, even if it's the elder themselves who wants to start exploring, maybe if they do want to age in place, and if likelihood would need assistance at some point, I encourage them to start exploring the agencies in their area. So what are some indications that it is time for an adult child or the well spouse to reach out to you and get an assessment?
Falls. Number one, falls. Number two, they don't drive anymore. They're not allowed to drive anymore. The doctor has said no more driving. And that is like cutting off an arm. That is the one activity that when that is done is the hardest to do. It is, to them, it's every piece of freedom. It's very hard to do, and it has to be done in a very, very in a gentle way. But those two things to me are continuous falls, missed medications, confused medications. What's wrong with mom? Well, she took 3 beta blockers. Okay, well, mom just fell, she bottomed out. So that's an indication that she doesn't know what medications she's taking. In the kitchen, she leaves things on the stove. She forgot to turn it off. She can't see very well, so she's eating rotten food. Any of those indications. A lot of it doesn't have to be that their health has gone down. A lot of it can just be generalized aging.
What about with the holidays approaching? Because too often the adult children, they'll talk to mom or dad on the phone and feel like, oh,
everything's
they
great.
sound great. But then they go for the holidays.
Holidays are always a big indicator for us. It's always a big push, whether it's Thanksgiving or over Christmas. Either, they come in and they're like, they walk into the house and they're appalled. Or they're like, mom isn't getting around as much as she used to. Oh, I'm fine, dear. No, you're not fine. And that's when we get a lot of calls, urgent consults. I'm in for the holidays. Mom can no longer take care of dad, even though she thinks she can, because she has her whole life. She is his wife, or vice versa. And they're like, mom needs help. And you have to approach that as, I'm not here to take your spot as being the wife. I'm here to give you respite so you don't hurt yourself or need a caregiver yourself.
What are some gentle ways that an adult child can open up the conversation with their parents in a way that preserves their dignity?
I like to say, just start off with, mom, dad, I'm worried about your well-being. I know that, you are, you're able to do your finances, whatever, but you're starting to break down a little. And I think it's time that we get you a little bit of help in here. And I have a couple companies that I've talked to, and I just want you to hear what they say. Why don't you just hear what they say? Because the first thing they're going to say is, I don't want anybody in my house. Nope. Don't want a stranger in my house. Not going to do it. Well, just come in and let's see what they can offer, just as added help for you, so that, either you as the caregiver or you as the client, a little added help for safety. And so you can take care of dad better, mom. I mean, you're going to break down yourself. And then where's dad going to be? They're going to have to put him in a SNF. So, and that's not what we want. So
what about family caregiver burnout?
Oh, always. We can do this ourselves. And it's always one family member that is stuck doing everything. And they go off the deep end. And that's when everyone starts to listen. And they're like, all right, well, and it's always the one who's willing to have, not always, but mostly always the one who will have home health come in. And they want to, a home care come in, and they want to do it. But all the other siblings, I don't know, we're not spending that money. And then she's like, all right, we're spending the money because I'm not doing it anymore.
So how about some advice of, don't wait to the point of burnout and breakdown, right?
Exactly.
be comfortable admitting that maybe you need a break sooner rather than later.
Exactly, because you don't want to make hasty decisions. I say that to the client too. Really think about this. Even if, and I follow up with them. I met with you last month. How are things going? I was going to call you. Can you come out again? Maybe we need to talk some more. Sure, not a problem. Because they may be against it at first, but then they have time to realize, oh, she did say that's gonna happen. Because I want them, and I cannot say this enough. I want them to have an educated decision-making process. Nothing works when you do it in haste. I need somebody out here tonight.
Mhm.
We can't. We want to start care tonight. Unless it's emergent, there's really no reason for it. And so if you wait too long, it's going to be emergent.
Right. And it's already a high emotion, highly stressful situation. So with proactive education and getting to know the resources, when the time comes, there's this comfort level that's already been built.
Exactly. And that's what you need. And that is the perfect scenario. It doesn't always happen that way. No matter how hard you try, you're always going to be, mom came home from the hospital, or the family's like, I can remember I had a client that should have stayed in the SNF he was in, but he really wanted to go home, and wife wanted him home, and she did not have a clue. We had to help her get the hospital bed. And nothing was paid for because she wouldn't put him on hospice. So she paid for all this out of pocket, and it went on for years. And he kept going in for sepsis, and it was so painful. And we would say, I think it's time you talk to hospice. She wouldn't hear of it. She kept putting him in. And finally he did pass. But I was like, if we could have only have convinced her that there was an easier way to do this. Pre-planning is everything. I've met with families who are like, I don't think mom and dad are ready for it yet, but can you come out and do an assessment and talk about what you offer?
Right.
Because I want them to think about it, and then follow up with the key family member and the family to see what's going on.
Right. So share with the audience the fact that just because they call you, just because there's an assessment, they're not. I think there needs to be some assurance that it's not a full court press of you've got to sign up for services. It's not an aggressive.
Not at all. And and they may be meeting with other companies. So you have to do your due diligence, follow up the next day. Do you have any further questions? And I tell them before I leave, I'm going to be following up with you tomorrow. You think of anything, here's my card, or when I call you, I'll be happy to go over anything else.
Because from the moment of contact, you're their advocate, right? Meaning, even if they don't sign up for services right then, but you've had a conversation, you've established the beginnings of a relationship.
Right. And you always have the ones who may sign up with the lowest price. And I still follow up with them. Let's say 30 days. How's it going, Mrs. Jones? Oh my gosh. They've called off 4 times, and we've had 15 different caregivers in a month. Really? How do you feel about that? Well, this is not working. Well, can I come out again and talk to you? We would like that.
Right. I think the moral of that story is, even if the one agency is you get what you pay for sort of thing.
You do.
And the fact that you continue to follow up is showing that you genuinely care about their well-being, even if they didn't sign up for services right then.
Exactly. And you need to tell them, you need to be honest and upfront and set expectations when you're in there. You want 24-hour care. I'm going to tell you right now, it's going to seem like a revolving door for 2 weeks until we get our mojo going and we get the staff in there that we feel is good.
Do you find, because I have found with families, so long as you're honest,
they're fine
in the
with
conversation, and it's about them knowing what to expect, so they're not blindsided, that they're very understanding.
Yeah,
it's because they're not blindsided by the experience that sometimes it takes those 2 weeks to really make things smooth.
I never tell somebody that you're going to have the same caregiver every day. I don't. That's not setting expectations. I'm going to keep it to the least amount of caregivers that work with your family member and are a good fit. I also ask them, what's plan B? Will you accept a caregiver that maybe if I introduce them and I go over the care plan with them for that shift, if someone else has called off, or do you have plan B? Are you plan B? Is another family member plan B? What do you want? So not only do I know, but our staffers know.
I love that, Sherry. It's not been very often that I've heard somebody how they integrate that into the assessment, the conversation, right? But that's such a powerful approach because should there be a call off, right?
We're not perfect. People get sick.
Well, you're not having to guess.
Right.
You're not having to figure it out then. You know what the contingency plan is and what they're comfortable with, what they want.
And sometimes it's a family member that says, call me or call my mom. I'm not going to call your mom. She's got dementia. She's going to say, I don't need anybody. I'm not leaving her alone. I'm going to call you and you make the call.
Right.
Do you want someone else? Who's going to check on your mom if no one's there? Or this person's going to be late. Will mom be okay? Or do I send out someone in my office, whether it's me or a staffer in the office, to sit with them until someone comes?
But there's already an established contingency plan,
always,
which I love.
It has to be.
So let's talk about, because you've been doing this type of work for quite some time now. You are rolling out a better solution in Cincinnati. So share with the audience your feelings on this new endeavor.
I am extremely excited. I love I just love the feel of how this works. I love the people I work with the corporate company. I pretty much, it's everything I envisioned as far as my feelings and my connections. I love the freedom we have and being able to work with our clients in that way and offering them a better solution. I mean, it's just not cut and dry. Like you have to have 4 hours and you have to have so many hours in a week and you have to go for at least a month and we want a deposit and all of that.
You're getting to take all your experience and make it be what you know
exactly
is going to work.
Right, exactly. And do I know everything? No.
Always learning.
I made lots of mistakes. Oh, yeah. Did I learn from them? Oh, yeah. Oh, yeah.
That's good. That's good.
Yeah, exactly. Well, and that's what I tell everybody. I said, you got to do something 10,000 times before you become an expert on it.
Sherry, so anybody that's listening today or will watch the recording at a later time, if they want to learn more information about a better solution, they want to schedule an assessment, how can they get in touch with you?
They can get in touch with me by the phone. It's 513-743-9393, or you can go to www.bettersolutions.com and learn more about the company in general. I can always send out brochures if they're just interested in that. I'm happy to talk with anybody on the phone that's interested. If I don't answer, leave a message. I'll get back to them as soon as I can, and discuss where their pain points are and what type of care is needed and what I feel we can offer them.
Can you repeat the number again?
Sure. It's 513-743-9393.
Awesome. Well, I really appreciate you being my guest today. And I do encourage anybody listening, especially if you're in the Cincinnati, Ohio area, to connect with Sherry on LinkedIn, to go to the website, reach out, whether you are somebody in the industry dealing with patients or clients. If you're a legal financial professional, definitely connect with her. She has tons of experience and education to back up this experience. So Sherry, thank you so much for being my guest today.
I enjoyed it. Thank you so much.
And as a reminder, I would like to thank our sponsor for the Empowering Aging podcast, Retirement Genius. They have alternative funding solutions. So for those that find themselves wanting to remain in home, or maybe they need to move into an assisted living, but they don't have the funds to be able to cover the cost, I recommend that you reach out to Retirement Genius. They are all things alternative funding solutions for senior care. So big thanks to them. And I hope everybody enjoys the rest of your day. See you again soon.
Thank you. Bye-bye.